what should you know about the antibiotic for it to start helping in the first days? In general, there are three main mistakes made by doctors when prescribing antibiotics. First, it's the choice of the wrong group of antibiotics. Second is the prescription of antibiotics without evidence to support it, that is, when it's unnecessary. And third, it's the selection of an inappropriate dose of the antibiotic. And the first components are the improper prescription of antibiotics, that is, incorrect without indications when there are no reasons. Most often, this is, for example, some kind of viral infection as far as the upper respiratory tract is concerned. And antibiotics do not affect viruses. And often, unfortunately, doctors prescribe antibiotics without indications. In some cases, they are just afraid of complications. In some cases, the patient asks to recover faster. Parents there are living through their children. And unfortunately, we patients cannot influence this first mistake. Unfortunately, the patient's parents also cannot influence the choice of the antibiotic group. Because this is the doctor's knowledge, this is experience. In some situations, it's even some kind of intuition, but it depends on the doctor, not the patient. But it depends on the patient, or rather, the assessment of the adequacy of the antibiotic dose may depend on the patient. And what needs to be known? You need to know that there is a minimum inhibitory concentration for each antibacterial drug. If a lower dose is prescribed, then this concentration will not have bacteriostatic or bactericidal action. That is, if an inadequate dose of antibiotic is prescribed, then immediately after its intake it can exceed the minimum inhibitory concentration and act on the microbes. But after some time, its concentration will decrease to numbers at which it will simply not work. Because of this, what situations often happen? For instance, the doctor is uncertain if an antibiotic is necessary and says, okay, it's unclear here whether it's needed or not. Let's just prescribe a small dose. And this small dose, it works sometimes, sometimes not. And then, when such patients come to me, for example, for a consultation, and you understand that the dose was chosen incorrectly, and you don't know why it doesn't help because it's a virus, or because the wrong group was chosen, or because the dose was simply inadequate. Therefore, the patient himself, he can just open the instructions and read what dose of antibiotic is prescribed for this or that condition. There's nothing complicated about it. If it's written in milligrams per kilogram, for example, it might say 20 to 40 milligrams per kilogram. I always recommend just choosing the maximum dose, that is 40 milligrams per kilogram. These doses can vary for different drugs. If it's a clear specific recommendation for adults, for example, 500 mg, 1000 mg daily, and the frequency of intake is written, that's also important. Once a day, twice a day, you can divide the daily dose. But in any case, this daily dose needs to be taken. No half doses, no insignificant doses. There's simply no point in that then. Take a proper good dose of antibiotic, and then it will start helping you in the next 24 to 36 hours.